Hello, I'm Dr. Arthur Rosner. I'm an otolaryngologist or ears, nose, and throat physician, and I am double boarded in sleep medicine. Today I wish to teach you about a new procedure that we're doing in the operating room called transoral robotic surgery of the tongue base and lingual tonsils. This is done for people who have obstructive sleep apnea who do not do well with their CPAP or continuous positive airway pressure. Sleep apnea is a serious condition that can cause early heart attacks, strokes, premature male sexual dysfunction, obesity, high blood pressure, and aging. So for those patients who are unable to wear a CPAP, surgery is the appropriate way to go. The new surgery involves using the surgical robot, and with that we are better able to work at the back of the tongue at an area called the lingual tonsils. This lingual tonsil tissue can collapse and cause blockage. And typically this is the tissue that is removed with robotic surgery for sleep apnea. Typically we see patients in the office who either are not tolerating their CPAP well, or for those people who do not want to wear a CPAP for the rest of their life. In the office we make sure that they're a potential surgical candidate, and then we go into the operating room and do something called a sleep endoscopy. During that procedure, patients are put to sleep with medicines, and a small fiber optic camera is placed into the nose, into the throat. And there we look as patients snore and stop breathing where the levels of blockage and collapse are at. If there is collapse at the back of the tongue, then the patient is a good candidate for transoral robotic surgery. If there is any need for nasal surgery, a septoplasty for deviated septum or shrinking the turbinates can be done at the same time. For those patients who have favorable collapse, typically they go in for robotic surgery, and in this situation the robotic arms are docked with the patient, and the surgeon myself works as a console to work the arms. The advantage of using the surgical robot is it allows much more precision and accuracies to get at the back of the tongue in angles that our hands couldn't do. It also allows for scaling so that my hand movements are adjusted to the right amount of space that need to work inside the mouth. Traditional surgery taking out the tonsils and trimming the uvula off, called a uvulopalatal-pharyngoplasty, are also done at the same time. The benefit of robotic surgery is the success rate is markedly better than the prior surgeries we did before. Where in the past we would reduce apnea in 2/3 of the patients, now with the robot we're curing roughly 2/3 of the patients so they no longer have to wear a CPAP. When surgery is performed, people typically stay in the hospital a couple of nights to make sure that they're swallowing okay and that their pain is under control. The risks of surgery include bleeding, swallowing problems, scarring of the throat, need for further surgery, and failure to cure the sleep apnea. If you know of a patient or family member who has sleep apnea and cannot tolerate the CPAP, or if you are a patient yourself, please contact our office to see if you're a candidate for the new robotic surgery of the tongue base using the Da Vinci robotic system.